first it was really like a little bit scary when I woke up.
You will lose some volume on the upper part because the skin will be expanded.
Okay, next. Hey, very good.
Looks really good.
This is the destiny. Natural nipple to implement.
Bye everyone, I'm going for surgery now. Wish me luck. At first it was really like a little bit scary when I woke up, but now I feel good.
Oh, okay, good to know. So then we can get discharged. We already got the precautions and we got some medication, some supplements from the clinic for patients who get breast augmentation with Motiva implant. And I think we just need to get changed and we can go to your hotel.
Yay!
It's like relatively kind of big at the moment because there's a lot of what's it called, swelling inside. So you have to realize that this is not the final result, even though it looks very good. So there's a lot of swelling. Make sure that you try not to sleep on your sides for the first week. And after we already grabbed your deswelling appointment and progress checkup with the doctor after 1 week, that's when you're gonna meet with Dr. Han. Until then, you need to wear this bra, okay? And all the instructions are written down on the paper, but if you have any questions, feel free to let us know, okay?
Going fast.
안녕하세요. 오케이, 들어볼까요? 오케이. 감각은 돌아왔나요? 감각 괜찮아요?
Do you feel sensations coming back?
오케이, 좋아요. 지금 지방이 잘 들어가 있고, 붓기가 아직 다 빠진 건 아니에요.
Surgery went well, but you still have some swelling on your face.
좋습니다. 상태는 아주 좋아요.
Looks very good.
오케이. 허벅지 많이 아파요? 배에서 뺐나?
Oh, it's bruised a little,
오케이.
but
그건
it's okay.
한 2주 정도 있으면 없어질 겁니다.
After 2 weeks it will be gone.
오케이, 좋아요.
Hi, Connie.
How are you?
I'm good.
Okay, I'm now checking your wound and the shape. Okay, so right now it looks like you have too much on the upper paw, right? But right at this time, at the surgery, this is okay. This is what I expected at this time. Okay, so time goes by, you will lose some volume on the upper part because the skin will be expanded. Okay, so then the upper volume will be decreased and lower fullness will be added. Okay, you still have some swellings so around your breast. So these swellings, including this belly, it will go out. Okay, so usually it takes about 3 months, 3 weeks to a month.
So doctor said that there's still a little bit more like volume and more like swollenness on the upper portion of my breast, but eventually when it heals, like 3 to 6 months, that volume will drop and it'll become more full at the bottom. But right now they're a little bit more asymmetrical and still swollen, just because they're healing and it'll take some time to drop. So yeah, the silicone gel is to stay under my breasts to protect my scars for about a month. But right now they look normal as it heals.
So Connie just finished her first swelling treatment. Today she received a LED lamp, which will help her to reduce her swelling, reduce any possibilities of inflammation, and overall helping with all rejuvenation of the skin in this area.
It was very relaxing. I almost fell asleep. I think it took like 20 minutes.
So Connie will have one more swelling treatment in a week. So it will be 2 weeks post-surgery. And we'll see you then. Bye!
오케이, very good.
Looks really good.
이제 지금 여기서 어느 정도 유지가 될 거예요.
So,
많이 빠지진 않아요.
From this point, like the fat cells he grafted will keep it on.
어느 정도 애들은 이제 자리를 잡은 애들이에요.
the survival rate is really good, and like they're trying to survive on this area that he grafted it on.
한 달째까지는 여기 눌리지 않게 좀 조심해 주시고.
So for the next month, you need to be careful, like, and not push on this grafted area.
이렇게 멍 다 빠졌나요?
How about this all gone?
It's okay, yeah. It might be normal, but yeah, it's still like hard right here.
이 부분이 약간
It's
딱딱해서
still
이거 좀
swollen.
important.
부드러워지려면 보통 한 3개월 정도.
So it will take around 3 months to get soft again.
So my hands are clean. Don't worry about it. But it's a little bit cold. Okay, how about the pain?
There's no pain.
You need time for the skin and soft tissues. It should be expanded due to the volume. Okay, so the shape will be changed much. So I have already told you the upper pole will be less and lower pole will be full. The total envelope should be elongated. This will look like much more fuller than before.
Okay.
Yeah, this is the destiny. Yeah, it will be done in about 2 or 3 months. Okay.
Hi Connie, how have you been?
It's been good. I went on tours, I walked a lot, I shopped a lot, and ate a lot of good food.
Oh, that's good to know. Let's talk more about your surgery. So how are you feeling now? It's been almost exactly 2 weeks since your surgery.
I feel good. I could move my shoulders and my arms a lot more now. Healing was a lot easier than I thought.
What was your first thought when you saw your breast? You woke up, you already know that surgery is finished. How do you feel?
I looked down and I was like, oh my gosh, it's so big. It was very swollen, so it was sitting way up here, and I was like, oh, it's so big.
How do you think about it now, about the size?
I think the size is good. I'm still waiting for it to drop. Right now it's still sitting very high, so it's hasn't fluffed and dropped yet. So I'm just trying to be patient and not look at it too much. First 2-3 days, my back was very sore. It was pretty difficult.
Because of the weight of the breast, or because of the laying on the surgery room for quite long?
I think both, the weight of my breast and just having trauma done to this area. It was hard to sit up straight or just move, be mobile with my shoulders, and just to do a simple task like flushing the toilet or just pressing things. I wanted to be very, very gentle, very careful. After that, the swelling went down and I was able to stretch a little bit more and use my arms and back more. I really liked Dr. Han. He performed my breast augmentation, and he is so thorough and meticulous with measuring my breasts from my nipples. It was very, very detailed and making sure that everything was even, taking into account my scoliosis and my uneven shoulders. I just really appreciated that, and he was very careful and thorough with explaining every step and procedure.
And tell us more about the result. Do you see difference? Of course, in terms of the breast, you see a difference right after the surgery, but in terms of the liposuction and fat graft, do you see how your face changed, and do you like these changes?
So I definitely have more volume in my cheeks now. The changes are very minimal, and I feel like I've adjusted to the changes already, but looking back at my old pictures, I definitely do see a little bit slimming at the jawline from the liposuction, and with the fat graft, it just makes my face glow a lot more because of the volume added, so I really liked it.
Thank you for coming for the interview today here. We really appreciate your time. We hope you recover really fast and swell fast as well, and we'll be happy with the final result.
Thank you. Bye. Hi everyone. It's been 2 months since surgery. I've been feeling really good overall. Not much discomfort, just sometimes sharp pains like around my breast area, especially my right side. There's still numbness around the scars. And the scars, they do look a little bit dark right now, kind of like purpley, but with my skin type, I feel like that's normal. I'm really happy with the jawline lipo. I feel like my side profile when I turn like this and when I just talk in general, I used to have a really prominent double chin even when I'm just like talking like this. So I feel like it has significantly like gotten much more defined, and I really like the results of it. As for my fat grafting, I do feel like I see difference like when I put on highlight or certain makeup styles. I feel like there's more volume around my cheeks. but it's like very, very small difference. It looks very natural. I know with like lighting and certain tops, like my boobs look good and it looks right for my body, but in certain clothing, I still feel like I should have gone bigger, maybe like 400cc or 450. I think upping the cc on that, I would have been more satisfied, but they have dropped a lot. I feel like I'll wait until 6 months. I think they'll look even better. Okay, that's all for now. Thank you so much. Bye!
Would you choose plastic surgery in Korea over other countries?
I saw a lot of results for the past 8 years of working, so definitely yes, the results are great, it's natural.